So last year, more than 100,000 Americans died of drug overdoses, mostly from opioids. But one of the DEA's top officials is now sounding the alarm about the next drug crisis, the ADHD medication Adderall. According to the DEA, the spike in stimulant abuse is due to the rise of telehealth companies during the pandemic. Telehealth providers are reportedly rubber stamping Adderall prescriptions, really without any due diligence at all. And while Adderall overdoses are rare, the consequences of the addiction can be very, very severe. Joining me now, the Chief Patient Officer for the wellness company, Dr. Drew Pinsky. Dr. Drew, it's always nice to see you. You know, when I read this from the DEA, I thought about friends that I have that just in the last couple of years have been talking about how they started taking Adderall. Oh, it helps me focus at work. I just called the doctor. It was very, very easy to get. I can work all night long on my projects. What's the issue with that?
Yeah, I mean, this is a very complicated landscape. This drug is not to be taken for performance. In fact, it's odd to me that universities don't address it as cheating. It's not, it's a psychotropic medication. It is a serious brain medication for specifically fully diagnosed conditions. Very few people are ever formally diagnosed, and even those that are formally diagnosed, I'm not convinced that many of those in adulthood should be on Adderall. We actually have a shortage of Adderall now, so much of it is being prescribed. And of course, a lot of this is the aftermath of the lockdowns. I was saying at the beginning of the lockdowns, we are going to destroy 8 to 15-year-olds when that period of development, when their cognitive development, the window for that development is so critical, and they are so dependent on their peers for their well-being. And then, by the way, we told them, hide under your bed, shelter in place. Right. If you don't do that, you're going to kill your family. Of course we cause mood problems, anxiety. But Adderall is not for those problems. So why are we seeing this widespread use of this medication? You might be putting your finger on it a little bit with these sort of rubber stamping in sort of various settings, frankly. But look, the reality is there are many people with ADHD that can be treated by a variety of substances, not necessarily with a psychostimulant. And I don't think you're going to see something like the opioid crisis with this. People aren't aware. People put all the blame on the drug companies. But the fact is, the way that thing rolled out was first, doctors were criminally prosecuted for inadequate treatment of pain. When that started happening, doctors froze, sent everything to the pain specialist. The pain specialist became evangelist for pain is the fifth vital sign. No patient should ever experience pain in the United States. Pain is whatever the patient says it is, and it was on after that. And so, look, you have to have evangelical physicians. You have to have a distribution system. On top of that, opioid overdose, when combined with the benzodiazepine, is very common. Adderall, it's not an overdose medication, but you can trigger manias, you can trigger psychosis, you can trigger depression's coming off it, and you certainly can make addictions worse or even trigger addiction.
Yeah, I was going to ask you, I mean, if they say that Adderall, there's not a ton of overdoses, if you're just using it, again, like some of the people I know have talked about, you know, I've got a really big presentation tomorrow for work, or I got to stay up all night studying. Why is it dangerous?
Like I said, look, it does work. This is the problem. It actually does improve performance. It's cheating, let's be clear. And when you're using a medication for a specific therapeutic purpose and using it for other than what it is designed, you are only putting yourself in harm's way. And the three big things is triggering a mania, triggering a depression on the other side, triggering or worsening addiction. It happens a lot.
How do you get off it, Dr. Drew?
Well, look, the generic name is dextroamphetamine. It is a psychostimulant. It is very close related to methamphetamine. And the stimulants don't have a withdrawal the way the opioids have withdrawal. There's not much tolerance to them. There's not a withdrawal syndrome. There is a reaction when you take this stimulant off the brain. You might be somnolent, you might be depressed, you might have cravings for other substances. I mean, there's a protein reaction to this. Might be unable to drive a car all of a sudden and not understand that you're, you know, having this somnolent reaction. But it's not a withdrawal per se so much as a reaction. That's provided that you didn't have some sort of bad reaction to it when you were on it, such as a manic episode. Yeah, that will persist even after you come off.
Well, yeah, you mentioned when you're on it, can it make you like more angry, tantrums, grumpy, that kind of thing?
Sure, sure. Well, coming off the grumpiness, but yeah, when you're on it, people get irritable, they get grandiose, they can make bad choices. Again, when you're using a pharmacological agent, something that really significantly affects brain chemistry for something other than for which it is intended, you are only going to put yourself in harm's way. It's not it does improve performance. It's not a performance enhancing drug. Again, I put some of the blame at the school system because the schools never call it out for what it is. It's drug abuse and it's cheating. And it should be treated as any other kind of cheating.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.